And basically, they've been working with our boys to work with them with feeding issues, sensory issues, and like Kate said, the pill swallowing clinic that she did in the clinics Tuesday and Wednesday is really kind of working up to helping our boys be able to swallow pills so that when we do get some of these clinical trials going, they'll be more successful with pill swallowing. So we're really grateful to both of you guys for working with our boys, and we're thankful that you've continued your work, and look forward to continuing the research that you guys have started. So, Dr. Stacey Reynolds.
Hey everyone. So I do know many of you because this is my 4th conference, and I am from Virginia Commonwealth University. I'm an occupational therapist by training and a research professor, sort of as my day job, and I'll be presenting with Emily Burgess, who is also an occupational therapist and works at a pediatric clinic in Virginia. So I did want to go through a timeline, and I'll do this very briefly, but it gives you a sense of where we started, what our goals were, and the second part of this presentation will really be like, how does all of the research that we've been doing translate into things that you can do with your kids, or if you are an affected individual, that you can do related to feeding and eating, really practical tips and strategies. So we started in 2010 when I got to the University of Florida, and my expertise and research was in sensory processing, mainly in children with autism and Fragile X, other genetic disorders. But Barry Burns' team said, hey, you know sensory stuff. These kids with Barth have sensory issues, okay? Really general term. Sensory issues means a lot of things to a lot of people. So we came in and we just asked the question, what are these sensory issues that boys with Barth have, and how does that impact their daily life, their occupations? And what we found through doing family interviews and some questionnaires was that the boys, and we did only look at boys originally, so up to age 18, had differences in how they processed taste and smell, and to some degree texture, so the feelings or how certain things feel. They seem to process that differently and to be more sensitive to those sensations. So taste and smell and texture kept coming up. And the area of occupation that it seemed to impact the most was feeding and eating, that there was a lot of these issues around mealtime, the boys being picky eaters, being very selective in the types of foods they would eat. So that's what we came up with, and that was published in the American Journal of Medical Genetics. So we were trying to get stuff out into the literature so people knew more about this. When we came back in 2012, we wanted to do a more objective study of how these boys perceived taste. And so if you remember, I actually did this with both boys and moms, so some of the moms here may have done this test as well. But we looked at their chemical taste sensitivity using chemical taste strips. And specifically what we were looking at was what we had learned in our interviews was that boys with Barth eat fewer, particularly were very picky about the vegetables and the fruits that they would eat. And a lot of vegetables and fruits have bitter compounds in them. And so we came back and we tested whether or not boys with Barth were super tasters. Did they tend to taste the bitter chemicals on these strips more than age-matched peers? So we had a control group of boys without Barth that participated. We also, again, did sort of family interviews to find out when these behaviors were starting, when these taste and smell sensitivities were starting, and what they looked like, so that we could get a more thorough understanding of what was happening. So in 2012, what we found out was that yes, in fact, the boys with Barth were what we call super tasters. They perceived the bitter compounds, the bitter chemicals, more intensely than boys without Barth. And so if you think about that, that makes a lot of sense, so that when they're eating things like broccoli or spinach or citrus fruits, that those foods are less appealing because they're tasting that bitter compound more intensely than a normal taster would. So again, we put that out into the literature. We also put it in the Barth newsletter and presented that at the 2014 conference. We came back again in 2014 doing more research because we had looked at this idea of taste, But flavor perception, how we actually decide what foods we're going to eat, is dependent not only on taste, but also really strongly on smell. And we hadn't really looked at smell at all, except for asking these parent questionnaires. And so we came back to the 2014 conference with some other questions. And the big one was, what is the contribution of smell to food choices in this population? We also wanted to look more specifically at why they were having these taste sensitivities. And so we wanted to look at receptors on their tongue. And I'll talk about how we measured that and looked at that. And then we wanted to get a better understanding, and this was Shelley Bowen's idea. Shelley, if you're in here, you told us from the beginning you wanted us to do a taste test with these boys. So we came back and we said, we're going to objectively measure how much they like salt, because salt was a thing that kept coming back up as they really like salt. They eat so much salty food. They put extra salt on their food. So was there a way for us to quantify this liking of salt and how much salt they were eating? So we came back and we found a way to do this in a very scientific sort of way. So I'm going to talk about this 2014 study, which is we did publish the initial results in the Bar Syndrome Foundation Journal, and they're being reviewed by another medical science journal. So again, everything we're doing, we're trying to put out there so that we're not keeping this information to ourselves, so that OTs or speech pathologists or whoever you're working with at home can access this information. So in 2014, we did what's called a cross-sectional study. It just means that we only looked at them at one point in time. We didn't look at them from age 5 to 7 to 9 years old, just one point in time. And we were able to get 68 people total enrolled, 34 males with Barth. And again, these were males. These were not just boys. We were able to get individuals all the way up to the age of 34. And out of the total 34 people, 11 participants were over the age of 18. And then we got an age-matched control group. So same number of people, same number of adults compared at one point in time. And we did 4 different tests. And what I'm going to do is just briefly describe what we did in case you didn't participate or watch them do it. I'll go through the results, and then we'll talk about what it actually means. So in 2014, we did a subtest of the Sniff and Sticks test. And somebody is here at this conference doing the full battery of olfactory testing. We did one subtest just to look at sensitivity to smell. So it's called the olfactory threshold test. At what point can they detect a low concentration of an odor between these odorant pens? And again, you guys have seen this now for 2 years in a row. So that was one of the tests that we did to get an objective measure of their smell sensitivity. The other thing that we did was we just asked for a subjective report. We said, how do you think your smell, your olfactory abilities compare to other people? Do you tend to smell things more easily than most people, about the same as most people, or less than most people? And from some of our younger boys, I kind of had to give the analogy of like, okay, if somebody farts in the room, are you the first one to smell it? Or are you the one who never smells it? And that seemed to work for some of them, because I have a 15-year-old boy, and they get that. So this is how we looked at smell. This was our taste test. And we did not develop this method. This was something that was already in the literature. But what we did was we had 7 different concentrations of chicken broth. So we started with a low sodium Campbell's chicken broth, and we added increasingly higher doses of kosher salt to those samples. And then we mixed the samples up and randomly had the kids sample them and tell us after each time, how salty do you think that was? And we used the picture cues, so a nighttime picture was reflective of a low salt concentration, a daytime picture meaning I thought that was very salty. And then we also said, how much did you like that? So from on a scale of I loved it to I hated it. And we were able to convert these visual analog scales into numeric values simply by, they were each a 10-inch scale. We put a 10-inch ruler down, and then we assigned a number to them. So from a research standpoint, we are trying to get really objective data. The last thing we did during the conference was that we took pictures of your boys' tongues. And I feel like, other people come here and they do things like blood draws and cardiograms. Like, that makes sense. We took pictures of tongues. But again, the idea was that we wanted to look at receptors. And so our taste buds, our taste receptors are housed in these papillae that are located on the surface of the tongue. And there's a direct correlation between how many papillae you have and how many taste buds or taste receptors that you have. And so one of the ways that we can look at taste perception is to measure peripherally the number of fungiform, is the name of these papillae, on the surface of the tongue. So we had the boys come in, we put some blue food dye on, we stuck a little measurement strip here for our reference, and then when we got home, we superimposed those images into Adobe Photoshop, and we created these 1 centimeter grids on the surface of the tongue, and we counted, this is a good research assistant job, counted the bumps within each one of those boxes. And we started out thinking we were going to be able to measure 8 different quadrants on the anterior dorsal surface of the tongue. These 2 boxes were really hard to measure. You can see in this picture how the tongue kind of curls down. We couldn't necessarily get those first 2 boxes. So when I talk about the results, it'll only be for the 6 boxes that you see here, okay? The last thing we did was that we asked parents and the adult participants to fill out a food inventory. And the idea was that we not only wanted to look at how much they liked certain foods, but how frequently they ate them. So the questionnaire looks something like this, where we'd present a picture. We'd say, okay, potatoes. How often or how much do you like potatoes on a scale from I love it to I hate it? And then how much do you eat it on a scale from never to many times during the day? And there was also an option to say, I've never tried this food. So again, I'm going to quickly go through the results of that 2014 study, and then Emily's going to come up and talk about what it all means. In all of these graphs that I'm going to show you, the Barth population is going to be in yellow. And I realized it should have been blue, but I realized that early this morning, and I just couldn't go back and change it. But the boys with Barth will always be yellow. The non-Barth boys, which is typical here, but non-Barth boys will be in blue. And anytime you see an asterisk, it means that the results were statistically significant. And so from a research standpoint, those are the results that we get excited about. So for that olfactory threshold test, the sniff and sticks test with the markers, the boys with Barth were significantly different compared to the age-matched control group. And the higher score meant that they had a lower threshold. They more easily detected the lower concentrations of the smells in the pens. And that indicates that they do, in fact, according to our one test, have a greater smell sensitivity compared to typical boys. Now, they're still within a fairly normal range of smelling. They're not, I wouldn't go out and sign them up to be, the wine tasters or the perfumers. They're not that good. But they are more sensitive to smells than probably most of us, people who do not have Barth. So, again, that kind of aligns with what parents had reported to us before, and it also aligned with how they subjectively reported for themselves. So when we asked them, do you think your sense of smell is more sensitive or increased, decreased, or about the same as most people? More than half of the males with Barth said that they felt like they had a heightened sense of smell, compared to only 11% of the non-Barth peers. Most of the people without Barth syndrome, about 3/4, said, yeah, my sense of smell is about the same as most people. Only about 1/3 of the guys with Barth said that their sense of smell was about the same. So these two measures, the objective sniff and sticks measures, matched up with the subjective ratings. So this is the results of the taste test, the chicken soup test. And remember, the first thing that we asked them to rate was how salty do you think these samples are? And we had those 7 different concentrations, from a very low, almost just a plain low sodium chicken broth, up to a concentration that would be not quite what you would be drinking in the ocean, but a very salty, fairly unpleasant concentration of salt in the chicken soup. And you'll see there's no asterisks here. So both of our groups, the boys with and without Barth, were able to accurately say which samples had more salt in them. That this is the saltiest, this is the saltiest, this is the least salty, and they were able to go up in that progression. So their perception of salt in these samples was the same. Where we started to see differences was in how much they liked those salty samples. So again, on the bottom here, we have the lowest concentration going up to the highest concentration of salt. And both groups actually liked the concentration of salt that was somewhere in the middle here. But the differences, where those asterisks are here. And the boys with Barth liked the salty samples, the highest concentration of salty samples, much more so than the boys without, or the males without Barth. And so at least this initial taste test seems to say that they have a higher tolerance of, or potentially enjoyment of, these intensely salty flavors, more so than the males without Barth. This is the graph that's from the tongues, from the blue tongues, when we were counting the tongue papillae density. And you'll see on the bottom, T's just means tongue. These are the regions, the 6 regions or boxes that we counted. And the higher bars here make sense because we have more of those papillae on the anterior or the front part of the tongue. You'll see again there are no asterisks here. And that means that there was no difference in these 6 different tongue regions in terms of the number of tongue papillae between the boys with and without Barth. I will point out that for 5 out of the 6 of these regions, the yellow bars are higher. And so there was some trend towards the boys with Barth having more tongue papillae, and again, sort of hypothesizing that they might have more taste receptors or taste buds. However, we couldn't support our initial hypothesis that the boys with Barth had this greater sensitivity to taste because they had more taste buds. Our results from this research study did not support that. All right, the last piece of data we collected was the food inventory. That was the one where we had the picture and we had the 2 rating scales. And the first rating scale was how much do you like this food? And so I'll just orient you that we had 6 categories. We had fruits, salty foods, proteins, sweets, veggies, and grains. And the way everything's colored here is that any of the foods in green are foods that the groups reported liking about the same. There was no statistically significant difference between the groups. The color in blue means that the typical group, or the non-Barth males, liked that food significantly more than the non-Barth, or than the boys with Barth. And anything in yellow, which there is nothing in yellow, this isn't a trick, but anything in yellow would be things that the males with Barth liked more than the non-Barth males. So you'll see, just to point out, that all of the boys liked salty foods about the same. So that really wasn't different between these 2 groups. Where we saw some differences were particularly in things that the typical boys liked more. Things like fruits. All of our fruits, the typical group indicated that they liked more. They also liked some vegetables more, particularly carrots and salads, and some of the whole grain foods, like whole grain pasta and whole grain breads. They reported a higher level of liking. Where it gets a little more interesting is looking at what kids actually eat. So this was how frequently they ate those foods. And you'll see that where the males with Barth come out as winners, the things that they ate significantly more than the non-Barth males were chicken nuggets and French fries, were the 2 areas where they reported eating those foods more often. The boys without Barth ate more fruits overall. They also liked the fruits more. They tended to eat more vegetables, including spinach, carrots, and salad, and they're eating more in some of the grain and protein categories. So if we look at it just in terms of the categories, what we're seeing is that the non-Barth males are eating significantly more fruits, proteins, vegetables, and grains, and they're eating about the same amount of salty foods and about the same amount of sweets. So to summarize the research, again, this is sort of where we've come over the past 4 to 6 years, boys with Barth do seem to be more sensitive to smells, and hopefully those results will be confirmed with the additional research that's being done by the group here today. Both groups, boys with and without Barth, like salt. And that liking seems to be about the same for most foods. Where boys with Barth differ is they seem to have a higher tolerance or a higher enjoyment of very salty foods. So foods that are more intensely salty, maybe than typical. And boys with Barth seem to eat certain salty foods more often, like chicken nuggets and French fries, probably because they don't like things or like foods like fruits, vegetables, some proteins, and grains as much as other boys. And our previous research had shown a sensitivity to bitter compounds that, again, are found in a lot of fruits and vegetables. That sensitivity to bitter compounds, based on this one study, doesn't seem to be attributed by the number of taste receptors alone. And that, again, was based on the tongue counts that we did. So what is it that is making them more sensitive to bitter compounds? It's probably a combination of both taste and smell sensitivity and possibly texture, which we haven't looked at quite as much, but maybe is a future area for research. I am going to hand it over to Emily, who's going to try and make sense of all of that and what does that actually mean for you all.
Good morning, or afternoon now. So now that we have all of this information from the research, what do we need to consider when looking at feeding and eating issues with our boys and our males with Barth syndrome? So right now we'll go over a few of the general considerations that we need to look at, and then we'll go more specifically into strategies that you all can take home with you and also work to further consult other professionals, OTs, dietitians, SLPs on for moving forward. So we know that we may need to take into account the smell of foods because we know that smell influences taste perception. We know that bitter tastes may need to be masked to increase the likability of fruits and vegetables, and we'll talk more about how to do that moving forward. The texture or visual presentation of a food may need to be altered to make it more appealing. So again, this was something that was found in previous research, and although it wasn't confirmed in the most recent line of research, we know it's something that we need to consider. And then sensory strategies or approaches may need to be used to help increase the repertoire of foods that our boys are eating. And most importantly, exposure to a variety of different flavors and textures should begin at a very young age. So in terms of dealing with smell sensitivities, like we've mentioned, our sense of smell affects our sense of taste. So we know that we need to try to eliminate unpleasant smells as much as possible. So we can do this by cooking in well-ventilated areas and using fume hoods or open windows. We can eat our meals in a separate room from the room in which they were cooked. We can use odor eliminators such as Febreze. We can use candles, air wick plug-ins, even essential oil diffusers, anything that the boys would find appealing. And then a fun strategy could be also having sweet smells lingering in the background while consuming more of these bitter foods. So for instance, having fresh baked chocolate chip cookies, which who doesn't like that, cooking in the background while we're consuming our more bitter vegetables. In terms of masking bitterness in food, so we know and we've learned that we need to downplay that bitter taste to be able to increase the likability of those fruits and vegetables. There are a couple different strategies we can use. We can either play up the sodium qualities of foods, or we can use more of the sweet route and go with more sweeteners to increase the likability of these bitter foods. And I just want to take a second to point out that we found in the research in this particular study in 2013 that aspartame was a particularly effective chemical for increasing the likability of these foods and decreasing the bitterness that was perceived in these foods. So we're not saying go home and chock your boys full of aspartame. We're aware of some of the negative side effects of aspartame, but we're saying it's something to consider as it's been shown in the literature that using these sweet compounds can help increase the likability and the consumption of these foods. So now we'll talk a little bit more about how to do this. So masking bitterness, we can try using different dressings. We can use ranch, any other dressings that might appeal. Sriracha sauces, hot sauces, as I've heard lots of the boys say that they already like. We can try oven roasting our vegetables with honey, sugar, salt, and other seasonings. And there's a picture here of Brussels sprouts that actually have been oven roasted with brown sugar and bacon. Trying different types of salt. So if we know the boys already like salt, we can play with the different flavorings of the salt. We can try garlic salt. One of my favorites is pink Himalayan salt. Whatever, and it can be a fun thing to try and taste test a few of these different kinds when cooking. Trying to add some more of those salt-based flavorings, so a soy sauce, or like we mentioned, the other hot sauces. And then I know a big favorite would be adding cheese to the vegetables. So what I want to say, moving forward with caution, is that we want to be able to use these tools to introduce the foods and to increase their likability and increase their overall consumption. However, what we'd hope to be able to do over time is to fade out some of these tools. So not necessarily having to douse the broccoli in cheese every single time moving forward, but being able to move away from that as the food becomes more likable and increased on a more regular, or consumed on a more regular basis. So also masking bitterness in fruits, we can look at taking more of the sweet route. So we can try dipping our fruits in yogurt or cream cheese. We can try sprinkling small amounts of sugar on pieces of fruit. So whether it's sugar in the raw, brown sugar, powdered sugar as we see below. And then one of my favorites would be blending fruits and vegetables into a smoothie. And there's a ton of fun recipes out there that you can research with your boys to try and do this. And you can include vegetables, and actually they still taste sweet. I actually have a best friend who consumes a spinach smoothie every day that tastes like chocolate. So altering the visual presentation of food. So as we mentioned, this is something that may not need to be considered for all of our boys, but we know that it's relevant. Avoiding mixing textures of food, especially those non-preferred textures with the preferred textures. So being able to keep things separate instead of presenting them in a chopped salad form. Using plate dividers or a tray like we see here to be able to keep the food separate. Now this is an important one, not adding too much of the non-preferred food to the plate. So we know we want our boys to eat broccoli, but if we present them with a huge plate of broccoli, more than likely all we're going to get is them pushing it away or food refusal. So we want to be cognizant of the fact that we can introduce the new foods and still include them, but in a proportion size that makes sense. And then also using opaque bottles for any liquids that might not be appealing. With considering texture, we know that tougher meats and proteins might be a little bit harder to handle. So looking at some softer options like non-meat alternatives, Boca burgers, and garden burgers. And then we want to consider the textures that our boys like. If we know that our boys like the crunchy textures, then we can use that to present the vegetables by really oven roasting them for a long time. We can actually try doing some fried vegetables and then dehydrated fruits and vegetables like the banana chips we see below. In terms of other sensory strategies, it's important to consider that if there are a lot of sensory sensitivities going on, so much to the point that the food repertoire is extremely limited and we're getting a lot of food refusal, we might need to take a step back from the table and look a little bit more at sensory processing and handling some of the underlying sensory sensitivities. And this is where consulting with a trained dietitian, SLP, or OT could be a helpful strategy. But in terms of things you can do at home from a very early age to help with the processing and acceptance of different textures and sensations, we can engage in messy play. So we can do finger painting. We can play with, I know Danny the other day had some great dry textures, like pastas and rice, and hiding toys in those textures, playing with those things. We can begin exposure to a variety of tastes and different textures at a young age. So really using up those flavorings that we talked about earlier and making our cooking really flavorful from a young age. And then we can work on reducing the gag reflex by using oral desensitization. So a couple of things with that. We can, from a young age, allow our boys, especially if they're being G-tube fed or fed through non-by-mouth means, we can allow them to mouth on a variety of items, teeth on a variety of items, and then we can work with a therapist using tools such as a nut brush. So the SOS feeding approach is something that we wanted to mention here today because it is an approach to feeding that can be useful in two ways. One, in the development of age-appropriate, safe, effective feeding and eating habits. And then two, working on the desensitization to a variety of different tastes and textures. So the sequential oral sensory approach is an approach to feeding that's more holistic, and it looks at oral motor development, so the development of jaw strength and tongue movements to support safe and effective eating and feeding. Behavior and learning, so it looks at some of the learned behaviors with feeding and eating, like food refusal. It looks at medical factors that need to be considered, which is extremely important with our population. And then differences in sensory processing, like the sensitivities that we've talked about here today to taste and smell and sight. And then nutrition, so what are the caloric needs of the child and the nutrition requirements with the diagnosis. With an SOS approach, we follow a stepwise progression. So we're not going to move a child who's not taking purees to move to taking the tough meats we talked about earlier and table foods. We're going to very much work in a slow, stepwise progression towards developing those age-appropriate oral motor skills. So treatment works both towards the desensitization to a variety of different textures, but also the development of age-appropriate feeding and eating skills to support safe and effective feeding and eating. So wrapping up today, we've learned a few things. We know that boys with BARTH have a variety of feeding and eating issues, and we know that these can be stressful. So we hope that some of the strategies we've provided here today can help with that. And then we're also available the rest of the week to talk to you all about that. Research suggests that sensory sensitivities, especially taste and smell, play a role in the food behavior, so like our selectivity and gagging. Oral motor weakness can also contribute to feeding problems, so oral motor functioning in general is really important to consider with regards to safe and effective feeding and eating. And then there are strategies families can try to work on these things at home, and that's what we hope that the biggest thing that you'll take away. And there are interventions like the SOS approach to feeding that an OT or an SLP, another trained professional, can use to help increase the repertoire of foods that your boys will eat, and that can help with any oral motor difficulties that might be present. And finally, the best approach is the team approach. So considering, most importantly, the child and the family and your needs. And then moving forward, the rehab team, the OT, the PT, the SLP, the dietitian and the nutritionists, metabolics, and cardiologists. And we just wanted to take a second to acknowledge that this research was funded by an IDEA grant from the Barr Syndrome Foundation, and that previous studies were supported by the National Institutes of Health, K01 and K12 mechanisms. And thank you guys for being here today, and if you have any questions, this is the time we'll take them.